Magandang umaga, Malacañang Press Corps, and welcome sa ating press briefing ngayong araw, October the 24th. During the sectoral meeting led by President Ferdinand R. Marcos Jr. this morning, the Health Department gave an update on the implementation of the Universal Healthcare Act. The President approved the creation of a Universal Healthcare Coordinating Council led by the national government in cooperation with local government units and other agencies in order to roll out healthcare functions within a well-integrated system. Among the points discussed were the cooperation of the DOH and DILG in ensuring good governance, capacity building, and delivery of health services by local government units. In the second meeting, the Energy Department also presented the steps the government is taking to mitigate high oil prices. And to tell us more about this, we have with us today Health Secretary Teodoro Herbosa and Energy Secretary Raphael Lotilla. Good morning, Secretaries.
Good morning. Good morning. Good morning.
Okay, let's start with Secretary Herbosa, please.
Good morning, everyone. This morning, I presented the updates on the Universal Healthcare Act of 2019 to our President. The UHC law was enacted on February 2019, and the vision was progressive realization that can be achieved through a systems approach, clear role delineation of stakeholders, and ensure equitable access and affordable healthcare and protection without financial risk. To give a background, we had once a very highly centralized healthcare system. This was devolved because of the Local Government Code of 1991. The DOH maintained its role as steward of national policies, plans, standards, and regulations, but healthcare now is delivered in a fragmented system of more than 1,000 LGUs. No? Under the Universal Healthcare Act, the DOH, the DILG, PhilHealth, and the local government units will endeavor to integrate, and that's the key word, no? Integrate into province and citywide health systems. I provided the following updates to the President. Since 2021, after the law was passed, 71 LGUs have committed to integrate their local health systems. These were called Universal Healthcare Integration Sites and consisted of 59 provinces and 12 highly urbanized cities, or about 66 or 93% of those that initiated preparations for integration and are gearing for full functional implementation of the integration plans and access to an integrated health system by its constituents. Also, by starting this year in 2023, we already engaged 5 UHC integration sites to become primary care provider network sandbox or trials or pilots. These are Baguio, Bataan, Quezon, Guimaras, and South Cotabato. And these networks, we contracted them, and they're being piloted as a test run for these networked healthcare systems. We also have additional, next year, healthcare provider networks with packages for additional payment mechanisms. Since the provincial or city health boards will be managing this citywide or province-wide health systems, it is important that members of the health boards, particularly governors or mayors as chair, are provided the necessary capacity to manage local health systems. The President approved the Department of Health's proposal of creating a Universal Healthcare Coordinating Council through an executive order. So we will be crafting and drafting this, and the council will be composed of the concerned government agencies, namely the Department of Health, which will serve as the council chair, the DILG as the co-chair, and the other agencies like DICT, DBM, DOF, PhilHealth, Professional Regulation Commission, NEDA, and probably TESDA, CHED, and DepEd. We will standardize the health policies. The council will serve as a national governance bodies that will oversee the implementation of Universal Healthcare Act nationwide. The project and estimate total national cost for UHC, and also implementation of the Universal Healthcare at local government level. It will serve as the venue to discuss relevant concerns that might be raised during the implementation of UHC. Further, the President also instructed the DILG to expedite the review of EO 138 on the implementation of the Supreme Court ruling on the Mandanas-Garcia petitions and incorporate some of these to the universal healthcare financing reforms in the amendments. So the Department of Health is very pleased with the President has given full support to the Department's vision of transforming the healthcare system of the Filipino through the Universal Healthcare Act. Thank you very much.
Thank you, Secretary Herbosa. Now we have Secretary Lotilla, please.
Thank you. Thank you very much, Daphne. Magandang tanghali sa ating lahat. The President called for the sectoral meeting in order to review the mitigating measures for high fuel prices. And among those who attended the meeting were the Department of Transportation, the Department of Trade and Industry, National Economic and Development Authority, Department of Budget and Management, Department of Interior and Local Government, and the Department of Information and Communication Technology, as well as the Department of Agriculture. So the highlights of the meeting resulted in the following. One, the President gave instructions on changing the language of the 2024 GAA provision on fuel subsidies for the transport sector in order to shorten the trigger period from 3 months to 1 month and simplify the release requirements. For those of you who are not familiar with the trigger period, whenever the Dubai price per barrel exceeds $80 for 3 months, then that will be the trigger for the provision of subsidies to the transport sector drivers, public utilities, including tricycle and other public utilities. So with this simplification or shortening of the period, we will be able to release the subsidies in a shorter period of time. The second is the simplification of the release requirements. So this time, as proposed by the Department of Budget and Management to Congress, the guidelines will need only to be agreed upon by the Department of Budget and Management, the Department of Transportation, and the Department of Energy. And these can be released upon the finalization of the list of beneficiaries by the Department of Transportation for those which have franchises, and then by the Department of Interior and Local Governments for those tricycle drivers, and by the Department of Trade and Industry for delivery service drivers. The second important point that was agreed upon was the implementation of the voluntary 20% ethanol blend for gasoline, which is targeted for approval by the end of 2023. As for those of you who are using gasoline, you know that we have a mandatory requirement of 10% blend of ethanol with gasoline, and the new policy that we will be implementing is voluntary and raising it to 20%. And this is primarily a price mitigation measure because ethanol, especially imported ethanol, is cheaper than the price of gasoline. So right now, the price of gasoline without ethanol is around 56.89. Then it will result in a price differential of around 1 peso and 28 centavos, or up to even 1 peso and 50, depending on, of course, on the prices. The local ethanol price per liter is currently around 79 pesos and 49 centavos, which is higher than the imported ethanol, which is at 41 pesos and 44 centavos. But local production of ethanol can only support 48% of the 10% blend, and therefore the utilization of a higher share of imported ethanol will result in lower pump prices because of the increased blend. And the other measure which the president wanted the the government agencies to work on is the continued electrification of the transport sector, particularly mass transport and light cargo vehicles. So the president gave emphasis on the need, one, for having the charging stations in place. Second, to make sure that the benefits to the transport sector, is particularly the drivers, will indeed be there, because right now, just from a fuel standpoint, the estimated difference between electric vehicles running per kilometer and those that are internal combustion engines using gas and diesel is quite significant. So for those using gasoline, the per kilometer run is at 5 pesos 30 centavos, but for the light duty electric vehicles, it's a range of 1 peso to 26 centavos to 1 peso to and 90 centavos per kilometer, whereas the cost for those running on diesel is at 4 pesos per kilometer. Of course, these are based on assumptions of the cost of gasoline at 70 per liter and the cost of diesel at 66 pesos per liter. The president also emphasized the need for preparing the economy for the eventual manufacture of electric vehicles in the country and linking these up with the local mining sector that will produce the minerals needed for the production of batteries and other components of electric vehicles. The other that the president and the cabinet members considered was the increase in the cocoa methyl ester, or the cocoa biodiesel blend, from the current 2% to 3%, and which can actually be accommodated by the supply of feedstock, given that the total coconut production at this time is, the entire country is at 15 billion nuts, and for the additional 1% blend, we need only an additional of 2.6 billion nuts. So on the whole, the increase in the blend can also drive down the cost of cocoa methyl ester, because they will be there will be a bigger market for CME. So right now we expect at least the diesel landed price, the pure diesel, to be at parity with the price of cocoa methyl ester per liter. So I think these are things that are good news for our consumers and our transport sector. Thank you.
Okay, thank you, Secretary Lotilla. Questions first from Joe Banahan, ABS-CBN News Online.
Good afternoon, Sir Lotilla. Sir, yung question ko, na-mention nyo kanina na yung simplification of release requirements. So ano na po yung mga requirements na kakailanganin for the fuel subsidy?
Well, the requirements before, that's why it took some time for the release of the funds or the subsidies, was that the Department of Transportation had to consolidate all of the lists from not only the those who are issued franchises by the Land Transportation and Franchising Board, but also those lists coming from the Department of Interior and Local Government and the lists from the Department of Trade and Industry. So in the case of the DILG, this would include not only the tricycle drivers, but also included the jeepney drivers. But since the DILG does not have the list for jeepneys, and they are with the Department of Transport, so we're simplifying all of these requirements so that the Department of Transport will be responsible for the list for those which are under the LTFRB. Then DILG will come up with the list for those which are with the tricycle drivers under the local governments. And then DTI will take care of the rest. And that will simplify the process.
Okay. Maricel Halili, TV5.
Magandang umaga po. For Secretary Lotilla, sir, you mentioned earlier yung tungkol po sa pagbabago ng language for 2024 GAA. So from the current 3 months, basta nag-exceed ng $80 per barrel, sa loob lang ng isang buwan, makakakuha na ng subsidy.
That will be the trigger now.
Opo. Sir, ano yung wisdom dito sa instruction ni Presidente?
Well, it will shorten the period, no, within which the subsidy can be released to our drivers, because before it would take 3 months, no? The difference is quite obvious in terms of being able to help the transport sector.
Pero sir, meron po ba tayong enough resources para ma-fund yung mga yung mga beneficiaries for this?
Well, the Congress has provided the proposal from the Executive Department for the 2024 GAA is 2.5 billion pesos. So that would suffice to cover the amounts needed.
Sir, last na lang. Sir, hanggang kailan po natin inaasahan yung pagtaas ng presyo ng petrolyo? I know it's dictated by the world market, pero hanggang kailan?
Well, the good news, of course, is that from the studies or the forecast made by Platts, the gap between supply and demand is going to narrow towards the end of the year and even continue in 2024. Because there are additional supplies that are coming from other countries like Brazil and the U.S., and the U.S. is lifting the embargo on Venezuela, so this will be adding to the supply, and hopefully there will be no black swans out there, no expansion of the crisis in between Palestine and Israel that might affect the oil-producing countries. There will be no further invasion of Ukraine and so on.
Okay. Sam Medanilia, Business Mirror.
For Secretary Lotilla, sir, yung during po dun sa discussion kanina para to mitigate yung high oil prices, na-discuss po yung possible na suspension ng oil import tariff.
No, that particular item has been discussed in the past, but the Department of Finance has explained that if we are going to do that, then it would actually be we would also be subsidizing the richer segments of the population, because their consumption of oil products is much higher than those which are consumed by those in the lower brackets. So the better approach is to have well-targeted subsidies, and that's why we want to simplify the subsidies being given to the public transport sector, particularly the drivers.
Okay.
Tapos, follow-up lang, sir. Yung sa projected po nila ng mga measures, yung multiple measures na na-mention nila kanina, ano pong potential impact nun sa oil price, yung overall? May parang expected ba tayong reduction sa pump prices kapag na-implement lahat?
Well, what is this? As we said, for example, in the case of ethanol blend, increasing the ethanol blend will result in more than 1 peso reduction in the pump price of gasoline.
Okay. Are there any questions for Secretary Herbosa? Okay. From Rappler, Dwight De Leon.
Hi, Secretary. What's the problem that we're solving when the government decided to come up with a UHC coordinating council?
The problem we're trying to solve is the fragmentation of the health system. We saw this during COVID because of the local government code. Local health systems were given to municipal mayors and governors. So when the UHC Act was implemented, the aim was to integrate health systems. So you'd come up with a provincial health board run by the governor, and then it would consolidate all the health systems in the different mayors in his province. So this is how the integration will happen. And what happens is there's going to be a special health fund, which was actually emphasized in the law. And that's why we created a council to watch the spending of the money on the special health fund, and that the implementation would be standard for all different LGUs. So the president knows that there are diverse implementations that are LGUs that are good implementers of healthcare systems locally, and there are those that don't put emphasis there. So they'll like to put a national standard, and that's where the council would be able to police or monitor how LGUs and local health systems will be spending funds or income from PhilHealth, income from the other local government units, and how the health system can be improved. Because our health systems are diverse. Some are very good, some are very weak. So depending on what their level are, that's how the spending will come. The president also asked us to compute really how much it would cost to have equitable health care. So that's the other direction the council will be doing, really being compute based on the demographics of the country.
Okay, thank you. Eden Santos, Net 25.
Secretary Herbosa, good morning po. Ito pong kikreate na Universal Coordinating Council, hindi po ba ito nangangahulugan ng another layer of red tape para dun sa ating Universal Healthcare Act?
Well, you can look at it that way, it's red tape, but to me, I think it's good governance. Because if you're going to give money to local government to be used in health, dati kasi yung health, yung money from PhilHealth, say, mayor ka, meron kang paanakan, the reimbursement of that goes to you, to the mayor. Pero ngayon, ipupool natin. So what happens is you pool the resources to that special health fund so that you can really allocate it for things that are needed in the local health system. So you also need to coordinate with the private sector. It can also receive funds. So meron ng mga provinces na nag-put up na ng bank account na may for the special health fund, pero zero pa ang funds. So hopefully, to be able to implement this, there are many things we need to do. The other one is COA needs to change the way they audit the financing system, because this is going to be different. It's going to be put in the fund and then reimburse people or pay for salaries of doctors and nurses, additional doctors and nurses. So yung pa isang pag-uusapan, and that's where the national government as a council can provide good governance and transparency.
Secretary, nationwide po ito, no?
Yes.
Ibig sabihin, mas magiging malapit po sa mga mamamayan itong universal healthcare. Hindi kailangang lumapit pa sa mga kongresista, sa mga senador, para po makahingi ng health assistance.
Correct, no? So the idea of the Universal Healthcare Act is really to strengthen our primary healthcare. So ito yung na weekend when we did the local government code, because the local chief executives would change the officials of the local health center every time a new mayor is elected or new. So with the integration, we are hoping to continue to build a stronger primary care. Yung pinakamalapit na health center sa inyo, lagyan namin ng laboratory, x-ray, ultrasound, maybe even telemedicine with the help of the ICT, para they don't clog the hospitals. Kasi ngayon, ang nangyayari, you visit the public hospital, siksikan talaga. Kasi bina-bypass nila yon. Many of those going to the hospitals should be treated in a primary care facility. Ito yung tututukan sa universal healthcare.
Last question na lang po, kaugnay lang nung malamig na panahon, Secretary. Ano po yung mga in-expect nating mga kadalasang sakit na nararanasan pag malamig ang panahon? Kasi bago po itong pagpasok ng amihan, marami na yung nagkasipon, nagkaubo, trangkaso, na matindi po. Hindi kagaya ng mga nakaraang panahon na talagang mabilis lang mawala or pwedeng gumaling.
That's correct. No, our epidemiology bureau has been monitoring the increase of influenza-like illness, yung parang trangkaso, at parang tumaas nga. There are some schools that converted to online blended learning because of the number of students. So it's really the time during the rainy season where respiratory illness increases kasi nga sarado ang bintana, we're in enclosed spaces, and people can really get infected. So reminder to everyone, season pa rin, get the flu shot. We have flu shots at the Department of Health. So if you're high risk, especially elderly and senior citizens, magpa-flu shot kayo. And then kung kayo ay may sakit, may respiratory illness, ubo, sipon, sore throat, it is better to stay at home than infect all other colleagues in the office or in the school. So very important yung self-protection. Things we learned during COVID. Pa-practice lang natin. Wear a mask also. The other way is masking again if you have cough, colds, or respiratory illness. Thank you.
All right. We have Ivan Mayrina, GMA 7.
Secretary Lotilla, sir. Gaano ka komplikadong proseso ang magpalit ng language sa 2024 GAA in terms of yung trigger period? I'm sure this is good news for the transport sector, but how soon can they expect to benefit from it?
Well, since the Congress is right now considering the General Appropriations Act for 2024, doon na yon ay isasalang yung amendment from 3 to 1 month.
So soon enough.
Effective in 2024, as soon as Congress approves the GAA.
Tuesday New, DZBB.
Hi, sirs. Secretary Herbosa, sir. Recently, sir, nabalitaan namin na may nagkaroon ng malawakang revamp sa PhilHealth. Pinalitan daw po yung matataas na opisyal ng PhilHealth. Ano po ang dahilan nito? Ito po ba may kinalaman doon sa recent incident ng hacking sa system nila o yung hindi pa rin pagkakabayad ng mga utang sa mga private hospitals?
Okay. So on October 7, the PhilHealth Board met, and ako ang chair, no, but I'm a non-voting chair. So it was the members of the board that voted against members of the executive council of executive committee of the PhilHealth, the executive vice president, the vice president for finance. They're named actually, and they were dismayed because of the recent Medusa hack, because I think part of the problem was the antivirus was not updated. And plus, they cited many other instances in the past, the delayed publication for the dialysis, etc. So it was a unanimous board decision, but we had to hold it. I said, wait a minute, it's election ban. You cannot move or transfer government officials like them. So we wrote COMELEC chair, and I think the news came out after the COMELEC chair gave me the exemption just last week. Just last week, the exemption was given. But right now, it's not yet implemented because the president asked for more time because he had a question to the GCG regarding its implementation. So as of now, it's actually for implementation. It's already exempted, but the board agreed to the request of the president and CEO to actually wait for the comment by the GCG, Government Corporate whatever. Governance Commission, yeah, that's right.
Okay. Alvin Baltasar, PBS.
Secretary Herbosa, good afternoon po.
Good afternoon.
Kamusta po, Secretary, yung PhilHealth system after the hacking? Okay na po ba?
Okay, so the system, I was told, the board was informed that the systems are up. Not all are up, but most are already up and available. Unfortunately, a large number of data subjects have been compromised. So yun yung another part, the bad part of this. So many members' personal and private information are out there on the dark web. So I think PhilHealth also has to, ang order ng board sa PhilHealth management was to create a crisis committee to make sure they follow and inform all members that whose data privacy has been breached. Kasi yun ang nasa Data Privacy Act. They have to inform all of them that your data has been breached and you change your passwords and everything. Be careful of phishing expeditions by hackers that can clean up your bank account because they know your birthday, your ID, etc. The second one we asked them is a business continuity plan. So to make sure that all the billing, members' funds, members' dues and payments, premiums are still being accepted. So as of now, functional naman. Yun lang, na-breach ang ating personal and private information of members and employees, including employees. So medyo marami yun and we're asking them to address that particular issue.
Pero Secretary, in terms of ibigay na tulong doon sa mga nakakailangan, hindi naman naapektuhan, ano?
Ang alam ko, hindi naman naapektuhan. They should be paying their reimbursements to hospitals and members' benefits.
Secretary, doon lang sa UHC Act, makakailangan ba tayo ng additional doctors, lalo-lalo na doon sa local level?
Yes, yan ang isa sa mga, kaya nga sinama namin doon sa Coordinating Council ang TESDA at CHED and DepEd because I think to really implement our Universal Healthcare Act, we need to triple some of our whole health system. So that means we need more doctors, we need more nurses. That's also part of the strategy that the Coordinating Council should be looking at. How do we keep a steady supply of human resources for health that will fuel and run the universal healthcare system?
Initial numbers, Secretary?
Iba-iba, no? Different depending on the doctors. But we have a lot of doctorless municipalities still. So we hope to solve that by other solutions. I don't have the numbers for you right now, but I can tell you that some of the solutions put forth is using telemedicine, which we also did during COVID-19. No? So doctors in the specialty hospitals can provide consultation to people in rural primary care areas. So by providing good internet access.
Okay, we have Jean Mangalus, INQUIRER.net.
Question for Secretary Lotilla. You mentioned that the economy is being prepared to manufacture electric cars, so we're partnering with the mining sector. Do we expect an increase in mining operations in the Philippines?
That would have to be addressed to the Department of Environment and Natural Resources. But what the general policy is that if we are engaging right now, for example, producing raw nickel ore, then we should graduate or elevate our into processing, so that we can get more value add from the nickel mining.
Okay.
Kay Secretary lang po ulit. Sec, kanina sabi niyo yung requirements, simplify, papa-i-claim yung 3 to 1 month. Kumusta naman po yung listahan ng ating mga beneficiaries? Kasi yan po yung kadalasan nagiging problema. Kung sino-sino ba talaga at ilan ba talaga yung mga dapat na mabigyan po ng fuel subsidy?
Yung listahan ng Department of Transportation, medyo malinis yan kasi licenses are being, or franchises are being issued by the LTFRB. So yung sa local governments, yun ang medyo mas matagal ang proseso kasi verify pa ng local governments and the DILG kung talagang ang listahan ay tama, no? At siguro ang experience natin nitong taon ay magiging magandang gabay na para sa next one. So we just need to clean up the list, but we don't need to start from scratch.
So ilan po talaga yung sa DOTR, yung sinasabi niyong malinis na yung listahan?
I don't have the numbers, but we'll find out from them.
Okay.
Yeah,
Katrina Domingo, ABS-CBN.
Sir, for Secretary Lotilla, first, at the moment with the current rule of the 3-month for the barrel prices. How much po yung sinispend ng government in total for the fuel subsidy?
I don't have the exact number as actually released by DBM, but last year or right now for this year, Congress provided for a 3 billion fund, and I think that has been adequate. It's really the speed with which we are able to implement that we're trying to address.
Sir, just a clarification on the numbers. You earlier said that the proposal in the 2024 GA is 2.5 billion. This year it's 3 billion, so it's shorter by 500 million?
That's the case, but it can always, of course, if the need is more, then it can always be augmented.
Sir, clarify, just to triple check lang, sir, meaning smaller yung budget for fuel subsidy next year, despite the change na mas magiging shorter yung span whenever the policy is triggered?
That's right. But that's based on the experience of the previous year or the present year, and that's why DBM proposed 2.5 billion. But of course, we don't know what will be the final amount that will be approved by Congress.
Okay. Ma'am, for Secretary Herbosa. Sir, very quickly, Singapore a few days ago confirmed that they are having a resurgence of COVID cases. Are we seeing a similar pattern in the Philippines, considering that, as you mentioned, influenza cases have been rising in the country?
Yeah, no, we don't have an increase in COVID cases. Singapore reported another variety of Omicron, but it's still mild and there are no deaths reported. So we just have to watch out for. We've consumed all our bivalents actually, the 390,000 that we have. We're just hoping that the fact that most Filipinos are completely vaccinated for COVID, the symptoms will be mild, and this new variety is also like upper respiratory mild infection. So
sir, what
we will watch it.
Sir, what happens now to Filipinos who have yet to avail of the bivalent vaccine? Won't they get a chance to get free shots from the government anymore, considering that it's gone?
Okay, it's a little bit complex because now there is a new vaccine that's out, and it's actually a monovalent XBB. That's the one that was announced by Moderna in the US. Apparently, what was discovered was the bivalent isn't as effective because the bivalent also increases your antibodies to the original, not the later ones. So parang 70% of the antibodies triggered are still the older ones. So in that case, it doesn't really protect you from the newer variants. So they changed again their formula and created the monovalent XBB. We will still think whether we will need that depending on our increase in cases. The people who will need now, because the symptoms of Omicron and XBB are mild, we think that the people who will need the vaccinations will be elderly and immunocompromised or with comorbidities. So we will have to study what the advice will be in terms of this. And we're looking at what other countries are doing and what WHO will recommend. But still general precautions for everyone. If cases will increase, we will inform you. The Epidemiology Bureau is monitoring our COVID cases.
Dwight De Leon Rappler.
Hello. Follow-up lang po kay Secretary Herbosa. Kanina sinabi niyo po the reassignment to PhilHealth officials is not yet implemented because President Marcos has a question to the GCG.
No, it's not President Marcos. It's the President of PhilHealth.
President of PhilHealth.
Because he's the one who's supposed to implement it.
Okay.
So the board, the PhilHealth board, is only strategic and policy making. So implementation of transfer should be done by the President and CEO.
What is the question, sir?
It's a question on. It's a question if that can be done legally. I think you can ask him because his question is something like, who has governance? Is it the board or the president? Something like that, and where it can be transferred. So.
Okay, sir. And follow-up lang po kay Secretary Lotilla. Yung relanguaging po, is it a request that's officially made by the executive branch to Congress?
Yeah, we are formalizing that, but that's why the president gave guidance that it's a go.
Thanks, Secretary Lotilla.
Yeah, thank you.
Thank you very much, Health Secretary and Energy Secretary. Thank you. Okay, may pahabol pa. Last question from Chona Yu of Inquirer.
Secretary Herbosa, sir, yung 390,000 na bivalent na sabi nyo kanina, hindi pa naubos?
Ubus na.
Ubus na lahat?
Ubus na.
Ah, okay. Akala ko.
Okay, that was a clarification. Okay. Thank you very much. Thank you, Secretary Herbosa and Secretary Lotilla. Very good news from the health and energy sectors, both, of course, addressing President Marcos' objective to deliver government services to every Filipino. So this concludes our press briefing. Maraming salamat, Malacañang Press Corps. Magandang hapon.
Thank you very much.
Thank you.